Well, this brutal winter is sending more people to the hospital worried about frostbite, but fewer are losing fingers and toes.
Now, that is because of a new drug that doctors are using. First at 4, Katie Tursik shows how this drug is dramatically improving outcomes.
By giving iloprost, we've been able to completely change the game in terms of frostbite and the resulting amputations. The number of amputations we've had to do this year is dramatically less, and the number of patients we've had with concerning injuries is dramatically more.
Dr. Deepak Orathil is a burn surgeon at Akron Children's Hospital. He says the drug opens blood vessels and prevents dangerous clotting.
Iloprost causes your blood vessels to dilate. Right? So that means they get bigger. So in this condition where there's not enough blood flow getting to those tissues, the blood vessels will get bigger and more blood can get to those tissues. It also stops the platelets from clumping up.
Doctors can give the medication up to 72 hours after a patient arrives. That gives them a much longer window than older treatments. Orathil says success rates are climbing from 60 or 70% into the 80 to 90% range.
It was only recently approved by the FDA. There are about 30 hospitals across the nation that are using it. As far as I know, in Ohio, we are one of 2 hospitals that use it.
The hospital has treated nearly 20 patients with iloprost since December, and this winter isn't over yet.
This winter has been really tough, and we've had a lot more patients this year than we saw all of last year, and we're not through the winter yet. I'm expecting that we'll be using iloprost a lot more before the season's through.
Canada and Europe already use the drug as standard care, but now it's saving frostbite patients here in Northeast Ohio. In Akron, Katie Tursik, 19 News.